It's not going to be the hospitals or the doctor's offices that fix this healthcare issue that we have. It's going to take a collective.
Dr. Alisahah Cole, Chief Community Impact Officer, Atrium Health.
Yeah.
Welcome to Health Matters.
Thank you. Thank you for having me.
It is such an honor to have you here today.
Thank you.
So before we start, I have a question. I want to ask why you chose the Get in the Blue Zone smoothie today.
Well, first of all, I love blueberries and I love honey. So I figured this had both, and so that was the choice for me.
What I love about the health conference and things that are happening here at HLTH is we are focused on women.
Particularly in medicine, it is interesting that we are at a critical time where we are actually now seeing more women enter into medical school than men. We have an opportunity to really increase women in healthcare from a standpoint of leadership. And so we still have a significant disparity. Really, that's one of the things that I'm passionate about, is how do I encourage more women and people of color to really think about healthcare as a career choice.
Let's talk about Atrium Health. So
Yes.
Tell us about the organization.
Atrium Health is one of the largest integrated healthcare systems in the Southeast. We're the largest safety net provider in the region and the largest Medicaid provider in the state of North Carolina. But now we're really also focused on how do we drive change in the community and encourage others to come on board and drive that change with us.
So let me ask, how does a health system make that change? Like, what is your role and how do you actually make that change in the community?
So we're looking at it from a couple of different lenses. One is identifying which neighborhoods or which communities across our region really are struggling with social determinants of health. What we found was that in the neighborhoods that had the highest social challenges, they also tended to have the highest rates of diabetes, the highest rates of obesity, highest rates of cardiovascular disease. There's definitely a moral imperative for us to do better by certain communities that have been systematically excluded. But there's now a financial imperative as healthcare is moving into a value-based model. I think people have barriers to achieving great health, and it's our responsibility now to really help figure out what those barriers are and help people overcome them.
Now, you're a nonprofit organization, right?
Yes.
So what are some of the challenges that you face in the community?
Well, I think part of it for us was we have always had this commitment to the community. What we didn't have necessarily, though, was a strategy. We really started to look at what is the work that we really need to be doing in the community, and we wanted to make sure that the priorities were going to be community driven. So each community had different social determinants that they were facing, but one of the ones that was consistent across every single community was food insecurity. And so that's how we selected food insecurity in 2017 as our first social determinant that we were going to build a strategy around.
Where do you feel behavioral health fits in all this?
Behavioral health is so critical, and it pains me that here in this country we've separated the brain and the mind from the rest of the body, but it's so critical. And one of the things that we are most proud about at Atrium Health is our virtual behavioral health program, where we now have, as a primary care doctor, I have the access to my psychiatrist, PharmD, who has expertise in behavioral health medications, social work, virtually, so that my patient, if I'm in the office and we're having a conversation and I'm like, this is a little bit out of my comfort zone, I need help, I need to phone a friend, I can reach out and have that consult, that virtual behavioral health consult done while the patient is in the office with me, which has been extremely helpful, especially in certain communities where there is still a stigma around mental health, like the African American community, for example. So I think that's a model that could be scaled across the entire country. And I think we just have to be willing to step out of our comfort zone a little bit and do things differently.
Well, thanks again for being here, Dr. Cole.
Thank
Here's
you.
to good health.
Cheers.
Cheers.